Hello, my name is Jeff Niles. I'm Chief Revenue Officer here at HWL. I'm here to interview one of our clients, Sandro. So, Sandro, why don't you introduce yourself?
Sure. My name's Sandro Altherr. I'm the Vice President of Provider Recruitment for RWJBarnabas Health. We're the largest academic health system in New Jersey.
Great. So, what's going on in the physician world? You obviously maybe tell us a little bit about your role and some of the challenges you face on a day-to-day basis.
Yeah, so that's interesting, an interesting question. And, basically, we see a lot of challenges on the day-to-day. I think the healthcare landscape has changed, throughout the years. I think specifically where our landscape is, we're, right next to New York City, so there's a lot of competition. We always joke because, we have our, hospitals and, we say you can go right outside the hospital and throw a rock and basically hit, another, competing hospital. So, fortunately or unfortunately, I think that that's just part of the landscape. And, that poses some challenges in itself, just with, all the healthcare, facilities and systems around us. So that's probably one of the biggest ones.
Okay. So what do you do to try to promote your health system to attract physicians? What are the things that you kind of hang your hat on as the hooks to get them to come?
Yeah, I think it helps that, we've really evolved as an organization over the years. And, we like to, I think we take a lot of pride in it that we're, one of the top health systems, regionally and nationally. And that definitely helps in recruiting physicians, from across the country. But basically, I think that really culture is the most important thing. And, in being in physician recruitment, we depend a lot on referrals and word of mouth, and we hire lots of docs, and they tell their friends or their colleagues or people that they went to medical school with, and we value those referrals quite a bit. And I think it's really just reputation. As I said, over the years, I think we've really built something strong in our organization, and it's kind of that generic attraction for some of the colleagues where, they see what we're doing across the state, and we're very transformative. And I think that helps attract a lot of physicians, from around the area and again, across the country.
Yeah, culture is important. It is. I think it's a big driver for a lot of physicians. They want a place, and probably the area too. A lot of them probably have families. They want to come and find a good place to raise their kids, and obviously where you live in that area is conducive to that.
Yeah, it's a great point, and I think something that's very attractive for the physicians and providers coming into our spaces. Listen, we really have options for everyone at any single time. Where if you want to be in a community-based hospital setting, we have options for that. If you want to be in an academic setting, we have a partnership and a collaboration with Rutgers Health, and there's a lot of those types of options available. We have partnerships with many joint ventures, and that's more of a private practice setting. So again, if a physician comes to us and they say, hey, we're looking for this, we'll try our best to try to place them, where they feel comfortable. And at the end of the day, we want to retain them and have them, enjoy what they do. So it helps that, we're able to kind of pivot and really give them what they're attracted to, prior to them starting, and set them up for success moving forward.
Great. So obviously you all use locums, like just about every health system in the country. What are the primary drivers for your, outside of, physician shortage, which is a real issue? What are the primary drivers for, why it is that you need locums from time to time?
It could be a combination of a lot of things. We may have someone who goes out on medical leave or, on maternity leave, et cetera, where it's short-term coverage, where we need a provider, and there's, really locums is in place for if there's a shortage of providers. So it could be a lot of different reasons why, that's one example. There could be long-term coverage needs where, we have someone who, ends up moving or, goes, elsewhere, and, there's, we don't have time to hire a perm, provider, but we have patients. We've had great examples of needing them, unfortunately, where, we've just expanded rapidly over the years, and, just to keep up with some of that growth, there is physician shortages, but if you're expanding as a system, year over year rapidly, there's a demand to be able to fill some of those clinical needs. So in all those types of situations, I mean, we would and they are valuable.
Yeah, for sure. So obviously you're an HWL customer. Tell us a little bit about what led you to make the decision to bring on an organization like HWL to help out in the locums world.
It's a great question, and I go to conferences, as you're well aware, and talk to people in the industry, and that question does pop up a lot. And I really like to just think about it as I think HWL is really just well-rounded, overall. Where listen, there's other organizations and platforms, and they have very fancy, reports, and they might have different types of capabilities. I just think HWL has the best all-around type of, performance where, you have a little bit of everything, but, sometimes you don't need all the fancy reports. You need just something that, hey, this works, the culture's great, we work well together, and that's really the reason why we were attracted to HWL was just, you guys kind of checked all the boxes to say, hey, you guys have this capability, you have this capability. And some of the other platforms may not have had all those capabilities, as far as looking for everything we were looking for.
Okay, sounds good. So I guess what are the biggest pain points that our team has been able to alleviate for you and the others at your organization, whether it's reducing the workload or making things a little bit more efficient? I guess what are the areas where you feel like you've kind of upped your game a little bit in the locums role?
So for a little bit of context, and I will say if you're part of a big health system, it just gets more complex overall. I would say, maybe there's single hospitals or health systems with, just a few facilities. I think you can get by. I think there's benefits overall using the platform regardless of your size, but as you get bigger, it gets much harder to do that. So for just an example, RWJBarnabas Health, so we have 12 acute care hospitals, 3 children's hospitals, a very large medical group, partnership with Rutgers Health, and various joint ventures that we work collaborative for them. And we really do the recruiting for all those, locations that I just mentioned. And the reason why I'm saying that is prior to going to a centralized platform such as HWL for locums, it kind of is like a little bit of a wild, wild west where, there's a lot of locum agencies out there, and, they may have a contract with hospital A, and they may, that same company or agency may have another, contract with hospital B. And there was actually one company, which I wouldn't say, the name, but they had, 7 different agreements with us in our system. So to answer your question now, to kind of bring it full circle, is having a platform such as HWL coming in, we say, hey, we're going to centralize this. We have basically, our preferred agencies. So these are agencies that we've worked with in the past and say, hey, we like what you're doing. You're cost effective. You have great performance. We vet them and say, we're just using this technology platform and we're picking the agencies, but we're going to centralize this process. So invoicing and just streamlining that whole process, that's all centralized. And that, I think, is the biggest benefit. And then we also have, an account manager and a director that work directly with us on that side to glue everything together. So I would just say, to answer your question, is it just centralizes the platform and just makes it much easier for administrators such as myself or our leaders, our chairs, our medical directors, where if they're saying, hey, we need, temporary coverage or locums coverage, this is the avenue that you go to. And it makes it very, very simple. Prior to that, it was not simple to make a long solution.
Yeah, makes sense. Well, thank you for your time today. Appreciate it and appreciate your business.
Thank you so much.
Thanks a lot.
Thank you, guys.
Yep.